cataracts. Welcome back, dear viewers. As people age, people become susceptible to developing macular degeneration diseases, such as cataracts and glaucoma. Let us talk more in detail about the most important diseases that affect the eye through our guest, Dr. Abdullah al-Kandiri, ophthalmology specialist, glaucoma and cataract surgeon. It's really a pleasure and honor to have you in Good Morning Kuwait, Dr. Abdullah.
The pleasure is mine. Thank you, Farid.
And definitely, you know, there is big terminologies there, so we need to, you know, cut them in pieces and try to, you know, put them in simple words for our viewers.
Oh, you should have seen when I started studying medicine.
I know.
Yeah.
That's the beauty of the
Yes.
medicine. So, Dr. Abdullah, tell us first of all, what is the harm of excessive use of electronics devices on eye and health?
Well, as much as all the mothers in Kuwait would love to hear me say that it does not.
Oh, really?
What it does do, it does a few things that are not related to the eye health itself, but to other things.
Okay, mental maybe.
Mental, yes.
Yeah.
It increases the rate. There was a Canadian study that showed that if a child below 2 years used the electronic devices for more than 2 hours a day, then that increases the risk of them getting ADHD, which is, you know, attention deficit hyperactivity disorder.
You see, one between two brackets, I just want to add something, because I remember during the States, there was a study, and this is related to yours. Is it true? I don't know. You just correct me. The study was about if somebody watching something and somebody reading a book. When you watch something, the activity of your brain is like a straight line. But if you are reading a book, the activity of your brain is like spikes. I mean, is that correct? So.
Yeah, I've read that study, and what you're saying is correct. You know, if you simplify it, then you are looking at something that has been, you know, pre-produced and montage was done, and you're just looking at it from A to, you know, when it finishes to Z. But when you're reading a book, you're imagining things, you know, so your brain is
so there is an active.
Working. There is an active, yes, motion.
Okay. So, speaking of our basically health, you said there is no harm.
There is discomfort, but it's not harm.
Okay.
What it does do, it does something called digital-related eye strain. And basically, to simplify it, it means that it causes dryness to the eye, some, you know, blurry vision associated with dryness for a few seconds to minutes, and it can also cause what we call, you know, achy or, you know, tired eyes. And that's not only related to the, you know, the devices, electronic devices. It's related to any close activity, including reading and writing.
So this could happen, but it's we can put it under the category of normality.
Normality, yes.
Okay, so what is the difference between white and blue water in the eye? Yeah, we always hear this. Oh, you have blue water. Oh, you have white water. I mean, which is the most harmful, you know, than the other?
Well, I wouldn't say which is the most harmful, but let's take it, you know, bit by bit. White water is basically what we call cataract, and basically you have the natural transparent lens that's in the eye. As we age, it starts to become cloudy, and once it becomes cloudy, it affects your vision. So in a way, it does affect your vision. The blue water, on the other hand, is what we call glaucoma. And what happens, you know, in glaucoma, you have high eye pressure, and that affects your optic nerve in the back of the eye. Okay.
So this comes from the high blood pressure?
Yes, in most cases it does.
Okay.
Not blood pressure, eye pressure.
Eye pressure?
Yes.
So this differs than
it's different from high blood pressure.
Okay.
There are links that have associations, but they do not cause, there's no direct link that high blood pressure causes.
So what causes the eye pressure?
Well, so far nobody knows exactly why it happens, but what we do know is that disturbances happen in the eye that affect the drainage of the fluid outside of the eye.
Okay.
And when that happens, it's like, you know, when you have a sink and you have a piece of paper on it, it's harder for the water to flow through it compared to when it's completely open. And that raises the eye pressure, which starts to, you know, compress and affect the optic nerve in the back of the eye. And basically when that happens, why is it important? Because the optic nerve is basically considered the cable that transmits what we see through this cable to the brain to create the image that we perceive.
Wow, that's, subhanallah, that's really
Subhanallah,
amazing thing. Is crying good thing when you cry from once in a while?
Well, I hope nobody cries.
No, absolutely. But I mean, but, is crying healthy?
I mean, going to the side, outside of the topic of the eyes, but crying, you know, is a way of expressing your emotion. So when we cry, we express our emotion. Trying not to cry and trying to hold in your, you know, your sadness, your anger. There are studies that show that, you know, it keeps on building up until somebody, you know, the trigger just loosens. And when that happens,
for example, what I'm saying, crying, sometimes you're watching a movie, for example. You remember Indian movies? They have really sad stories, back in the days. Correct?
Correct,
yeah. Sometimes, you know, your tears come down. We are human, right? I mean, is this good in itself?
Yes, of course.
Yeah, it's good for the health of the eye?
For the health of the eye in that situation, yes, it is. Because basically any activity that you concentrate on for a while, what happens is usually we blink 15 times per minute. But when you concentrate on something for a long period, you blink less, around 5 to 7 times per minute. And when that happens, for you to get tears into your eyes, you need the eye to blink so that the tear flows and moistens your eye. So yes, it is helpful.
Good. So we hear about the cataract surgery. Can you talk us about the causes of this disease and how to avoid it and the treatment? So first of all, what is cataracts?
So as I mentioned earlier, it's basically the normal transparent lens that's inside the eye. As we age, it starts to become cloudy because the natural proteins start to denature and clump. So that's why it becomes cloudy and we start to
sometimes
not
you see
well.
blurry thing.
Exactly. So what causes it? Mainly aging, which is a natural process.
And we can see now on the monitor.
Yes, we can see the cataract as you see in the lower right picture. So with aging, this is a natural process. Other things that can cause cataract include, you know, excessive exposure to sunlight and UV light, use of corticosteroids for a long period of time. If you have systemic diseases, steroids. Steroids, yes. If you use it for prolonged periods, it increases the rate of the cataract developing in the eye. Other things like, you know, diabetes. You know, can increase the rate of cataracts forming as well. And other things as well include, you know, trauma. Trauma itself can also lead to cataract. Okay,
so definitely this is now the case. We are trying to, you know, Dr. Abdullah definitely trying to enlighten us and enlighten our viewers, so be careful. This is the eye, you know, that's basically the diamond of our, you know, heads, as they say.
Of course.
So does glaucoma affect vision, and what are the causes of glaucoma in the eye?
Well, yeah, it does affect vision. In comparison to the cataract, which affects our vision early on in life, in glaucoma, that's why it's also called the silent thief. Because the silent thief of vision, because what happens is
steals your vision.
It steals your vision slowly, you know, but you don't actually notice it and feel or see the symptoms until very late, when already the damage has become very severe and advanced.
So what kind of symptoms we should note?
There's types of glaucoma, but the most common type is asymptomatic, which means there's no symptoms. You only feel the symptoms when you become very late through the disease, when it starts to affect your vision, because what happens, it affects your peripheral vision first, and it starts to encroach until it starts to affect your central vision. So that's why it steals
the sides, you know, once your sides are blurry, means.
Yes. And subhanallah, this is a gift from Allah subhanahu, that both eyes compensate each other.
Yeah,
so you don't feel these areas until very late.
So you have to close one eye.
Yeah, but do we consciously close our eyes? We don't.
Can't. Yeah,
yes.
That's true. That's subhanallah. That's very smart. Even diseases are really smart.
But there are rarer types that since birth, and that parents will see tearing, large eyes. The corneas, or the outer side of the eye, will be cloudy, and usually it's since the child is born.
So does white water in the eye turn blue and when?
Yes, it does.
Oh.
That happens when you leave the cataract until it's very cloudy. It's very thick and dense. So when that happens, it starts to push, the colored part of the eye, the iris, the brown, blue, yellow color.
Yeah.
It starts to push it, and when that happens, it closes what is the natural drainage angle of the eye.
Oh.
So when that happens and it closes, the eye pressure goes up, and then yes, you can get glaucoma, and we call it phakomorphic glaucoma because it happens from the cataract.
So it turns to blue.
That's why we always say, if you are going to go ahead and do the cataract surgery, which is a simple, delicate procedure, takes around 10 to 20 minutes. Don't wait until your lens becomes so hard and dense, obliquating استوت.
Yeah, استوت. Yeah, don't wait until it's too late. Absolutely. So are these specific things that raise eye pressure?
Well, yes, there are. As I mentioned earlier, steroids also can raise the eye pressure.
Okay.
Other things other than the medications like steroids, they are, life habit activities. Okay, I mean, if somebody is meant to have glaucoma, then he's meant to have glaucoma.
Doctor, remind me, steroids comes from what?
You mean the corticosteroids?
Yeah.
It's usually naturally available in the body, and it's produced by the adrenaline glands.
Okay. So when steroid affect the eye?
Yes, can affect the eye. It can raise the pressure, especially if you use it for a long period. So now you have steroids that can cause cataract and can cause glaucoma.
Wow.
But you need to take it for a long period of time. Other things that, life habits, that we do and we don't realize.
Like what?
For example, like, everything in moderation is perfect. If you exceed the moderation part, you start to get problems.
Exactly.
Exercise in moderation around 30 minutes, 3 to 4 days a week is perfect. It actually lowers the pressure. But if you exercise intensely for more than 1 hour every day, then it actually increases the eye pressure.
Yeah, that's definitely, definitely, and exactly. Modernization is really being in the middle always, and as we say in Arabic, خير الأمور أوسطها. Yeah. So is it glaucoma hereditary, and how do I protect myself from glaucoma?
Yes, the majority of cases they're hereditary. They found that there's mutations that increase the susceptibility of people getting glaucoma.
Really?
That's why we always ask, when a patient comes to my clinic, I always ask, do you have a family history of glaucoma?
Yeah.
Because
is it genetic or?
As we age, everybody can get glaucoma.
Exactly.
But if you have a family history, then that risk is doubled, or actually it's by 9 times.
Oh.
Yeah. That's how high the risk becomes.
So, doctor, what are the latest devices used to diagnose and treat eye problems? For example, back in the days, there is this professor, which is well known internationally, Dost, the Iranian, I guess, doctor. But I mean, now definitely the science and medicine field is really large, and there is definitely new techniques, new ways.
I'll talk about my specialty, which is glaucoma and cataract. In terms of glaucoma, the treatment for glaucoma, and that's can you avoid it? No, but if you catch it early on, then we can treat it early on so that no more damage can happen and you maintain your vision. So currently we had drops, lasers and procedures. Now we have an extra, new devices where we have injectable, releasable drugs. So basically, you don't have to take your drops, 3 drops, 3 to 4 times a day. You just inject the implant, and it remains in your eye for, and dissolves by itself over, 6 months to 1 year.
Amazing.
The other things that are new to the field are, we have like what we implant tubes, where we bypass the normal, not working drainage of the angle. And nowadays we have a tube where magnetically from outside the eye, after doing the procedure, I can actually adjust how much of drainage I need. Yes, and it's something that takes a few seconds. So that's in terms of glaucoma. In terms of cataract, we have new devices, because in cataract you have to replace the normal lens of the eye with an artificial lens.
Yeah.
And this artificial lens...
this is what's called LASIK or laser, or it's totally different?
It's different, but we can do both together.
Both together.
So basically, you put usually a monofocal lens, and what that means is that you will see far, but you still need reading glasses. But you have then the premium IOLs, which is basically gives you far and near.
And near.
And we have, let's say, like in our clinic, we have an eye trace machine, which basically... because the issue with premium IOLs is that we never know if the patient will be comfortable with it until after we do the surgery. But with this new machine, what basically it does, it predicts the likelihood of the patient accepting this premium
Amazing.
IOL.
That's really advancement, definitely.
It is, yeah.
It's really, definitely, we don't know, because exactly you are in the field and you know what's the most latest and advanced, devices and procedures. Dr. Abdul Kandiri, ophthalmology, thank you very much, specialist and in glaucoma and cataract surgeon. Thank you very much. It was really an honor, and basically you enlightened me, and honestly, and my viewers. Thank you.
Thank you very much. I'm glad to be here.
Thank you. The Carabao mango.